Let's take a closer look at COVID-19 and SARS and how the industry responded. So when I was putting together these slides, I had to keep on updating this number every day because right now we're sitting at over 500,000 global cases, and of, of COVID-19, and we are actually also sitting at 21,000, over 21,000 global deaths, and we still don't know what the global economic impact is. And interestingly enough, on March 12, 2003, the World Health Organization actually issued a statement about the severe acute respiratory syndrome, or SARS, and indicating that it is a serious issue as an epidemic because they had over 8,000 cases and 774 deaths. And on July 5th, 2003, they actually got the SARS epidemic under, well, I guess they got it contained under control. So you're looking at a 5-month period then of SARS back then. And you see the number of cases are not even near as much as what we have right now with COVID-19. And in the case of Toronto, then Toronto actually lost 2 million room nights. And as a result of that, they saw a 45% decrease in overall tourist expenditure. And when you look at all of the sectors of the tourism industry, the whole tourism industry, so you had accommodations, food and beverage, events and conferences, all those sectors there, the amount of money that was actually lost was $342 million. And that was from March to July in that period, according to KPMG. And then when we look at Hong Kong, actually in a study that was published in an article by the Asian Economic Papers Journal, they actually stated that the SARS epidemic in Hong Kong was more severe than the 9/11 terrorist attacks that took place in 2001. And because they saw a 59% decrease in overall international arrivals, which then resulted in a $542 million revenue loss from April to June for that period. So, we're dealing with some pretty serious stuff here. And let's now look at how the tourism stakeholders, all of the managers and the destination marketers, how did they handle that epidemic in 2003? So in order for me to properly explain this to you, I'm going to be using this crisis management strategic planning framework model to show you what was done at each stage of the SARS crisis. So we're going to look at what was done in the pre-crisis stage, which involved the planning of essentially putting together a crisis communications plan. Then we go to the acute stage, which is when we look at, okay, the crisis is currently happening and we can't go back. We're currently in it right now, especially with COVID-19. And then in the chronicle stage, you look at, okay, you do a full assessment of the whole disaster. It's like you do a disaster audit to see what essentially took place and what you have to deal with right now. And in the review stage, this doesn't happen until about a year or so after the crisis takes place, when you look at how you handle the situation. So let's just go right ahead now. And I want to introduce these two studies that were observed here. So these studies were done in Toronto as well as Hong Kong, and various stakeholders were interviewed, ranging from hotel managers and directors from 17 hotels in Toronto and six hotels in Hong Kong to see how they responded to the crisis. So in the pre-crisis stage, in terms of the operational activities, first what they did is that they developed a crisis management plan. And all of the hotels who responded to the survey, they stated that they had their crisis plan that was integrated into their overall strategic plan. And although all of the hotels who were interviewed had this plan, only 50% of them said that they actually reviewed that plan within a 5-year period. And those that did review it, they said that they had a more, not really say so easy, but a better chance at really managing the crisis than those hotels that did not review their strategic plans on a frequent basis. And in those plans, they identified response team individuals, key persons who would be the spokesperson for the organization in the event of a crisis taking place. And They also had, those plans featured ways to cooperate with both the private and the public sector. And this took place in different training sessions with public health departments, as well as hotel associations and so forth. And really just to get a scenario going and to say, okay, well, if this happens, how are we going to handle it? And to really identify early warning issues throughout those sessions. And so in the acute crisis stage now, in terms of the operations, what they did is when SARS was currently going on, the various hotels sent information out to their partners, the partner properties. They sent their managers information and stated, okay, this is how we want you to handle the situation. And we're in this right now. I mean, employees were asked to take a vacation or unpaid leave. Salaries were reduced and businesses were closed as a result of the epidemic. And just before that started to happen, they started to do some marketing and sales efforts by offering heavily discounted packages to really try and boost hotel occupancy at the last minute. And the new strategies that were introduced in terms of marketing now, what they did was they stayed in touch with their hotel guests through telephone calls, courtesy calls, as well as email marketing, really just to kind of maintain the relationship with them throughout the whole process. And another new strategy, or well, previous strategy, what they introduced is they actually provided new offerings such as cleaning services to corporate clients. So because hotel occupancy was so low in Hong Kong and Toronto, they actually got some of their hotel staff to go and provide cleaning services to corporate clients outside of the hotel. So so it was interesting to see how the tourism product and the accommodation sector has changed as a result of the crisis in this situation. And some of them even offered guest rooms as temporary office spaces available to rent. So because they didn't have the traditional guests who stayed in the property, they even rented it out to different corporate clients who had to have meetings and so forth. So what new marketing examples are we seeing now during COVID-19? So first thing I'm definitely seeing a lot of is the rise of virtual tours. So we have new technology that's available to us now that we didn't have 17 years ago. So in 2003, we could not do virtual tour of a hotel or a destination. It wasn't possible back then, I don't think. So I'm seeing a lot of virtual tours being offered now. And even in our case, in the Bahamas, you can go on our website and you can take a virtual tour of the Bahamas right now. So this kind of approach really, because everyone is experiencing social distancing right now. And although people aren't traveling, I know the UNWTO issued a campaign recently or a statement that's saying, by staying home, we can travel tomorrow. So we are still finding ways to inspire travel through different types of technology to our potential clients. So that's just one way of doing that.